Dr. Sheard, could I just ask, it was actually Rachel Parker, who's the University Students Association president, had asked if we could record the events so that staff and students would be able to view them at a later date. I'm just wondering if you're happy with that.
Yes, that's absolutely fine.
Good.
No, because I'm sure you'll get lots more students viewing it that way. Well, thank you very much for tuning into this, and I'm very pleased actually that it is going to be recorded, because hopefully that does mean that some students will be able to see it at their own convenience. I'm employed by NHS Highland. I'm the Oban area psychiatrist, so I do kind of have SAMs in my immediate catchment area. Part of my background is that I trained in Edinburgh, did work in the University Health Centre there with students for about 6 months as part of my psychiatry training, and until I rejoined the NHS about 3 years ago, I worked in Sydney, Nova Scotia for several decades next to the University College of Cape Breton, which received quite a few international students, a range of undergraduate students, and I've had years of experience working with students amongst the other people that I've looked after. And I think because I also have a side interest in attention deficit disorder and how important it is to recognize and treat that, that's kept me tuned in to the value of intervening with mental health issues early in student life and helping students keep their optimum health for the place that they're studying in. So I want to kind of divide my talk into two chunks. One is the concept of the healthy student in a healthy place, kind of what is it about a student that helps them, if you like, give themselves a sort of MOT, and then I'll say a little bit about some mental health disorders we get involved in, but particularly ADHD, because there often isn't much said about that as it applies to adults.